Today, it's all about the kids.
Help kids like me get better.
The Y107 Missouri Credit Union Miracles for Kids Radiothon.
We believe in miracles.
You kind of got the whole story with Aiden's journey there from Taylor's kind of blog posts that kind of came through a whole range of time there. And you get the highs and you get the lows. And that's, the benefit of this hospital is that there are highs. There are amazing highs, even with the lows. Somebody who could probably tell us the whole story of the hospital is actually sitting in front of us today.
Absolutely. We celebrate the 40th anniversary of Children's Hospital at MU Healthcare being a Children's Miracle Network hospital. The CEO of the hospital, Ric Ransom, is here. He's almost celebrating his first anniversary at MIZZOU. First of all, early congratulations, sir.
Thank you, Cosmo. Thank you, Kristin.
Very welcome. Well, the new hospital it's almost here. The cranes are down and the building is up, and it's exciting times.
Yeah, we're at a really exciting moment in time where the exterior work is done. They're finishing out the patient care areas and the lobby. We actually began moving patient activity into that building in just a couple of weeks, and we should have it fully occupied with patients by June.
Oh, wow.
Wow, yeah. So why are they building this new birthing facility on the main campus?
There are three main benefits, and the Keene location has served the organization, patients, and the community very well for years. But one of the disadvantages of pediatric care on Keene Street is it's been a little bit further away from some of the pediatric subspecialists that are on the main university hospital campus. So closer proximity to all of the wonderful caregivers that are sometimes involved with the care of a child is one of the advantages. Another one that you can kind of tell by looking at the building is it's bigger, right? So we actually have more space for patient care, research, and teaching that all happens in our buildings.
Absolutely. And I know the NICU is getting expanded and all that. What makes this so unique? What's special, this gem here in mid-Missouri that's getting ready to open?
Yeah, so I'll start by sharing some of the pediatricians that I've worked with over the years have described that kids are not just little adults. Like, what goes into the care of a child is different. And when you think a little bit about having a kid-friendly interest, having play areas that were designed to distract and entertain children who are undergoing sometimes difficult medical treatments, very frequently, probably more often than not, our pediatric patients will have a sibling, right? And so having an environment for the care of the child, the patient, that also takes into consideration the needs of the entire family, including siblings. We have special outdoor areas with play parks, flower gardens, and other spaces for the family and the patients to be able to relax.
Absolutely. And that's something we've heard time and time again, year after year, that it's for the whole family. The care is not just for the child that's sick or injured, that the care specialists really do take into consideration the rest of the family, because sometimes mom and dad are also thinking about the other child at home.
Mm-hmm. Mm-hmm. And especially, the moms that come in and they give birth, their care doesn't end, right?
Correct.
Even if there's this tiny little baby they've got to take care of, sometimes the mom also needs to be taken care of as well. And so what are some of the ways that this new children's hospital are going to benefit those moms?
One of the big benefits for moms and some of our tiniest patients is being able to have all of that clinical activity in the same general area, the same floor. We also will be able to have our NICU, where our tiniest patients are being cared for, that will have all private rooms, and those rooms will be larger. So as you have a chance if you ever get the opportunity to see a NICU team do their thing, there's a lot of technology, there's a big group, and having a space where they're able to collaborate and then provide care to those very tiny babies is really conducive to the overall care experience.
Well, you look at a situation, I know Dr. Pardalis and the other NICU doctors, we just saw Bo and Bryce Edwards walk out of here. They're 19 feet tall. They were some of the tiniest of tiny babies here 17 years ago in a NICU unit, and we look at our board, and there's 44 of those little babies in that unit right now today. As we talk to the CEO of the hospital, Ric Ransom, with us here. He's coming up on his 1-year anniversary. The hospital's getting ready to open in June. Why is it important for mid-Missouri to have such a strong children's hospital?
Yeah, so MU Healthcare and our Children's Hospital and Birthing Center is really, I think, an anchor for pediatric care in the central part of the state of Missouri. And for folks who live throughout the state, we really want to be able to provide access to cutting-edge technology, clinicians who are highly trained, without having to have people go all the way to Kansas City or St. Louis in order to receive that care.
Absolutely. And we've heard that time and time again from parents saying, thank goodness this is here. Yeah, we have to drive 30 minutes from Jeff or wherever, but it's here and we're not going 2 hours away just to see our baby.
Thank you so much for taking the time to be here today. If somebody is listening right now, why would you tell them they should be a miracle maker today?
The programs that we use to care for children, like therapy dogs, the use of child life specialists, those are things that are incredibly beneficial to pediatric patients that don't bring with them any reimbursement, right? Blue Cross Blue Shield doesn't pay for that, Medicare doesn't pay, Medicaid doesn't pay for that. And so it's fundraising activities like this Radiothon that allow us to bring additional resources to bear that make a tremendous difference in the care of pediatric patients. So it's things like this Radiothon, and I understand there's a wonderful history of success with this Radiothon. It's giving at moments like these that really make big differences in the care, the day-to-day care of pediatric patients at our children's hospital.
Absolutely. The resources, some of the technologies, things, the giraffe omni beds and those NICU units that you talked about are things that came from your generosity over the years from Radiothon. Well, again, welcome to Mid-Missouri. I know you're coming up on 1 year anniversary. We got to figure out where you're going for that big party. We'll come up with something. Maybe go get you some smoked wings over at D-Rose or something.
I was thinking the same thing.
There you go.
You have adjusted to Columbia just fine, sir. Well, congratulations. We can't wait for the opening of the new building, and exciting times for sure with MU Health.
Cosmo, bless you and thank you. Kristin, bless you and thank you for having me on the show.
Thank you, Rick. It is the 18th Annual Missouri Credit Union Miracles for Kids Radiothon on Y107.